The next category is health and beyond. As you all know, as we've just heard today from the presentation we heard at lunchtime, it's just not health interventions. It's also what you can do and many, many things that can happen around the health arena and the health sector that can help transform opportunities for all of us. So the Health and Beyond award really focuses on tackling the root causes category and the root causes issues that are related to health, and this is of critical importance. This year's commended program gave 14 journalists from across Africa the skills and information necessary to produce quality coverage of women's health issues in Africa, empowering them to accelerate change and put their concerns on the political agenda. And I'd like to take this opportunity to congratulate Thomas Reuters Foundation for its Women's Health and Opportunity Reporting Program. As you all know, Reuters is a globally known information technology and communication company that has been around for a considerable amount of time, and I'd like to give them the commendation for the great work that they continue to do in promoting health communication around the world. And we have, ma'am, I should have your name on the teleprompter, but I don't, so you'll forgive me.
Thank you very much.
Congratulations to you.
Thank you.
Many public health interventions in developing countries founder simply because they rely on an income stream from governments, from NGOs, from international organizations, donors, who themselves have limited and sometimes unpredictable resources. This year's winning company is innovative in both its approach to a public health problem and its financial model, providing over 880,000 water filters to 91% of households in Kenya's Western Province. The winning program is designed to not only improve health outcomes, but also to be fully self-funding. Because residents no longer need to burn wood in order to boil their drinking water, within the first 6 months, the filters had reduced carbon emission by 1.4 million tons, allowing carbon credits to be claimed and sold and income generated as a result. The project has the added benefit of reducing the burden of women who have to collect wood, women and girls, who traditionally shoulder the disproportionate share of the responsibility of not only fetching water, but of finding the firewood with which to boil that water. And I'm very proud to announce that the 2012 winner of the GBCHealth Business Action on Health Award in category of Health and Beyond is Vestergaard Frandsen.
Water has to be boiled in every home. They boil water to drink. How do they boil the water? Firewood. Where's the firewood coming from? Trees.
So Carbon for Water is a campaign where 4,000 health workers and another 4,000 drivers visit 900,000 homes. In those homes we will install the life straw that filters water, and as a result the need for boiling water is no longer there.
Bringing carbon finance to this sort of project is really revolutionary. This project will reduce CO2 by 2 million tonnes per year. That in itself makes it one of the biggest carbon reduction projects in the world.
I'd like to take this opportunity to congratulate Vestergaard Frandsen on their Carbon for Water program. Accepting the award is Vestergaard Frandsen's Managing Director, Climate Business, Alison Hill. Alison?
So I just want to say a very big thank you to everybody here, and anybody who knows me or the project knows how excited I get to talk about it, to see the video, to see the images. I speak for my extraordinary team in Kenya and the 250 other employees that we have at Vestergaard Frandsen when I thank GBCHealth for this award. It's a huge honor as a small company to be able to be recognized alongside the much bigger companies that are here today. This award has been given for tackling root causes, and I am, in every sense of the word, very proud to say we've done that for more than 4.5 million people in Kenya in this one project. We've done it through the life straw filters that you just saw in the film. They eliminate the bacteria, viruses, and parasites that are often found in the groundwater, streams, and rivers that Kenyans collect and drink on a daily basis. We have, 1 year in, some really exciting health impact data coming out, so I will give you a very quick sneak peek of that. We have an ongoing study with Oxford University and Dr. John Haskew looking at health impact for children under 5 in the province. To date, the preliminary data shows with statistical significance that the odds of presenting with diarrhea are 29% less for children that drink filtered water than children that don't. More interestingly, the odds of dysentery are 53% less, and what is very exciting to me is that the odds of severe dehydration, which is one of the leading causes of child mortality in the region, is 70% less in the children that drink the filtered water. We're now looking at the HIV/AIDS population to look at health impact, and in about a year we should have that data coming out. I have, for the last 2 years, spent most of my time in Western Province, and I actually just got back 2 days ago from 6 weeks of doing a health education and training campaign. I can tell you that family after family is reporting that their incidents of typhoid and other waterborne diseases are gone. This means less absence from work, fewer days missed from school, and less stress on the health systems. But this is not just a story of technology or reaching the hardest to reach populations. This is a story about how do you finance public health in a sustainable way. Designed to be sustainable and registered for 10 years, Carbon for Water is the first ever carbon finance program to feature health outcomes. The carbon credits issued, as was mentioned, is about 1.4 million tons in the first 6 months of activities. It's the largest project on the market and the first ever to link safe drinking water. The credits are our way of recouping our investment, the same investment that was used to put 880,000 filters in households across the province. And this pay-for-performance model is also incredibly exciting for the public health world. It is the first time that revenue and finance for a public health program is directly tied to achieving health outcomes and behavior change. So no money comes into this program until we are able to demonstrate and be verified against the behavior change that we've created. And that creates a whole new incentive structure. So the program directly incentivizes us as a program implementer to invest in a large-scale, province-wide full-time program and to go house to house every 6 months and do health education and training. Just over a month from now, many of us will be joined together in Rio to discuss the ways where we can mitigate climate change and accelerate human development. While the commitment of governments to this two-pronged goal is crucial, we think that it will be business that will bridge this gap. Not only must we seek to achieve climate mitigation, climate adaptation, and development goals, but we will have to be very creative about the way we create incentive structures. As Carbon for Water continues to improve the health of Kenyans, we won't rest on our laurels. We are actively looking at new ways to link health outcomes and environmental outcomes through food security initiatives, agriculture initiatives, and other water-based initiatives. Thank you again for recognizing our efforts to bring clean water to Kenyans who desperately need it. But most importantly, thank you, GBCHealth, for encouraging innovation, for continuing to support businesses, both large and small, to make a difference in public health. Thank you.
Thank you all very much. Have yourselves a good afternoon.